All right, let's talk about dementia. Dementia is a progressive neurodegenerative disease. Alzheimer's is the most common form of dementia. Ultimately, it causes systems in the body to start failing because they're not receiving signals from the brain and therefore end up causing death. It is currently the highest cause of mortality for females and the second highest for males when you look at those genders individually. All rates, incidence, prevalence, mortality, morbidity, they're all increasing. If you are aged over the age of 90, you have a 1 in 2 chance of being diagnosed with dementia. And based on current figures and numbers, there is a 2.5 times increased projected numbers over the next 40 years. So while everything else is going down, this is projected to go up and go up significantly. All right, risk and protective factors for dementia. So your big three again, age, gender, family history, all right? Except this time, it's more about females as opposed to males. Modifiable risk factors though, we've got overweight and obesity, physical inactivity, poor kidney function based from diet and if you have diabetes, etc. Head trauma and social isolation and untreated hearing loss, which leads to good social interaction. These things are very highly linked to dementia. Protective factors, regular exercise, healthy diet, specifically one that's high in fruit and vegetables, so highly plant-based, and engaging social activity, specifically as you get older. So where and for whom is dementia numbers changing or more rapidly becoming an issue? So age is obviously the big one. The older you get, the more likely you are, up to that 1 in 2 number, to be diagnosed with dementia. However, early onset dementia, so under the age of 65, is increasing as well. Females is the big one, mainly because females have longer life expectancy, therefore they are more likely to be diagnosed with dementia. However, because females also offer the primary caregiver role in Australia, so generally in society, after the age of 65 when you retire, females will more than likely volunteer or care for other people, but then they get dementia, so then they need care, and it becomes this snowball effect, which is why dementia, and specifically Alzheimer's, is causing a significant burden on the aged care sector here in Australia, and it's only projected to go up like we discussed earlier. It's a major issue in our healthcare system currently, and we do need to get on top of it, otherwise this is going to be extremely bad in the future. And that was your too long, didn't study version of dementia.